I would like to discuss what I think one of the big problems with Western medicine is, okay? And there's more, so if I don't include the one you're thinking of, feel free to comment. Maybe I'll make a second video, but I can't cover everything. Now, that being said, Western medicine is awesome. It's done incredible things. But if it was really, really good, and all around really good, then we wouldn't see the health problems that we're seeing today, like heart disease and strokes, cancer, depression, anxiety, insomnia, etc. So there's some glaring holes in how we're caring for people and how we're promoting people's health from like a Western medical standpoint. Now, this is philosophical and partially my opinion, so I'm willing to be wrong here, but this is the way I'm looking at it. Because there's really a couple of approaches to healthcare, and I don't really think one's necessarily better than the other, because I think they're both better at certain things, and we need the combination of both at the end of the day. So they're both equally as good. I just think situation by situation, one philosophy works better than the other. Okay, so the main philosophies is one would be like a mechanical approach, or you could say a reductionist approach, and the other would be more of a holistic approach or vitalistic approach. Okay, so let's talk about Western medicine as a whole, which is typically reductionist or materialist or mechanistic. Okay, so what this means is essentially, or this idea is like everything's a machine. We can take the machine apart, reduce it down to individual parts, understand how those parts work, and then understand how the machine works. Holistic's more like the entity is more than the sum of its parts. Okay, so maybe I'll do like a deeper philosophical video on this, but I don't want this to be that. I want this one to be kind of short, just like one simple idea. So what we're going to focus on is the idea of looking at things mechanistically versus holistically. So you could take a beautiful Rolex watch and you can give it to, you know, a bright engineer from, say, like the 1950s, and they could take that watch apart, like especially if it's a wind-up watch, so no battery or anything. They could take it apart and really understand how it works, and they could see all the parts, they could see them moving, and then if there's a problem with the watch, that engineer, understanding how the pieces work, could find the problem and fix the part or replace the part, and then the whole, the entity works again. Now, why medicine works really well with us is because we do have mechanisms, right? We do have machine-like qualities in our body, and that's why we're really good at certain types of healthcare. Okay. However, humans aren't really like a wind-up watch. Okay, like parts of us work that way, but if you look at us as a whole, we're more like the new watch, which is like your cell phone, or even we'll say smartwatch. Okay. Because if you gave that same thing, like if you give your cell phone to a really good engineer from the 1950s, they could take it apart and understand some of it, right? Because there's hardware in there, there's pieces. Now you don't really have like cogs and wheels moving, but there's like hardware. And if you gave it to an engineer, I guess more in the present, that understood like circuit boards and computers, they would also maybe have a better understanding how it works. But cell phones are even more than that. So it's more than hardware, and it's more than software. It's also the field. So your cell phone is your cell phone because of its ability to gather information from its environment. You know, cell phone towers, Bluetooth, Wi-Fi, whatever, right? So it gathers information, and it learns and adapts. It downloads good applications, good programming. It downloads bad things, things that interfere with the ability of the cell phone to work the way it was designed. And also it sends information too. So it sends and transmits, it receives, and therefore it's more than just what's contained within it. It's like its environment as well. And I think that's an important thing to think about when looking at the whole person. So a holistic provider looks at everything and understanding the network, so to speak, and understanding what's being downloaded, what is maybe on the entity, on the person that no longer needs to be, like old applications, old software, what needs to be updated. And you can't just do that by reducing something into its parts. Okay, and I think that's probably the big breakdown and the reason why like healthcare is not better currently is because we need both views of health to work together, and the field is largely dominated with one idea of what health is. So those are my thoughts. If you disagree, wonderful. I'd love to hear about it. And if you agree, like, subscribe, share with some friends and family, and let's keep the conversation going. Okay, bye.